Hey, what's going on? Dr. Taylor, Spark Chiropractic. I want to talk to you about something kind of weird today. You got a short leg? Do you? Maybe? Odds are probably not. Have you ever been told you have a short leg? If you've been to a chiropractor or a PT, you probably have. Now, we say things. Now, I will take full responsibility for this. For all the PTs and all the chiropractors, I'll take the blame. We say this so you understand it even though it's wrong. 99 times out of 100, you don't actually have a short leg. So let's go through some anatomy here, right? Let's start way over here. If this is your lumbar spine, right, your low back, so L4, L5, tailbone, pelvis, this here is where that short leg comes from. If you notice, I totally drew this intentionally. The top of the crest of that hip, way above the top of the crest of that one. Now, what that is going to do is going to cause your short leg. And I put it in quotes for a reason, because again, your legs aren't actually short. If we've got our hip bone here and our hip bone here and our femur comes out like that, femur comes out like that, where they connect to the hips and pelvis. If you've got a dysfunction in your SI joint, that's this joint right here, stands for sacroiliac joint. If you've got an issue in that joint, that's going to cause a leg length discrepancy, aka a short leg. Now, if I take this thing and I'm going to turn it toward the camera, right? So we're going to be looking straight down from above. I'll draw this one over here. So here's our tailbone, okay? Our lumbar vertebra, number 5 is on top of that. 4 is on top of that. Spine's coming out towards you. Now, if we look at our pelvis or the crest of our hips, notice the orientation of this joint, right? It's at this 45-degree angle. So as I'm looking at you right now, my SI joints are oriented like this. And what that does is it allows the hip and pelvis to rotate forward and back. I'll say this for the guys out there. If you ever walk behind somebody and you see their butt kind of moving like this, whoever that may be, that's because of the orientation of this joint. It's designed that way on purpose. So what happens, if we go back here, we'll do a better drawing. We've got our tailbone right there, and we've got the crest of one hip in our pelvis here, and the crest of the other hip in our pelvis here. These things move forward and back with this kind of rotation, right? So that's why the shake comes with the fries, if you follow me here. And then what happens, like I said, we've got our hip bone going on here, and we've got our femur there coming out like that. And we've got L5 here, L4 here. Now, when we've got this leg length discrepancy, this short leg, first thing that's going to happen, if you present and you actually tell me you got a short leg, awesome, you're already on it. If you're not that far into it, what you're going to do is you're going to tell me I've got a pain right here, right at the top of your butt, basically, because what goes on, there's a muscle there. We've got the glute muscle, the big ones in back, but what goes on here, there's a muscle that lies underneath it called your glute medius. Basically kind of goes horizontally like that, and it connects down on the outside of your hip. Now, muscles only pull. Your bicep pulls, your tricep pulls. When this thing pulls, it causes the lower leg to abduct, abduct, to be taken away. So, more often than not, the time when this thing is contracted and active the most is when we're standing on one leg. So basically, the right one is active with 50% of the steps we take. The left one is active with the other 50% of the steps we take. And if we've got a dysfunction in these hip joints and these SI joints, creating that fake long leg, one of these muscles is going to be far more active than the other one. What happens to an overactive muscle? Spasms up, gets tight, causes pain. You go to fix it. You come into the chiropractor or the PT and you tell them, hey, I've got a pain right here, right in the top of your butt. Or if it's been long lasting, it'll cause other compensations going down the leg. And then who gets blamed? The IT band. The IT band gets blamed for more stuff that's not its fault than any other swath of tissue in the body. The IT band is just a big old connective piece of tissue. And it gets blamed for all kinds of stuff unnecessarily because it's simply a compensation for any kind of these joint dysfunctions going on up above it. So, long story less long. Have you been told you have a short leg? Have you gone to a PT or a chiropractor and they lay you down on your tummy and you feel them grab your feet and they lift them up and they check, oh, one of your heels is sticking up further. It's not actually an issue with the bones in your legs. Odds are they're probably the same length. But you've got an issue in your hip joints and your SI joints causing a rotation in your pelvis, which is putting more stress on one leg or less stress on another, More stress on one muscle, probably your glute med, or less stress on another. We'll throw another one in there just for the sake of being thorough here. There's another guy that runs right down like this, called your piriformis. You probably heard of that. It's also a stabilizing muscle of the hip. That thing gets blamed a lot for something called piriformis syndrome. If we got this here, these green are the nerves coming out. It's your sciatic nerve. Crosses right underneath that piriformis muscle. So when that thing gets pissed off, it contracts, spazzes up, presses on the sciatic, causes sciatic-like symptoms. But once again, it's only doing what it's told. And it's told to do stuff based on where the bones are. So if you've got issues in your SI joints, you can get pain right in the top of the glutes, top of the hip here. You can blame your IT band unnecessarily. But the easiest way to check to see if this is an issue that you got going on, or if this might be part of the issue anyway, take your shoes, the ones you wear most often, turn them around, look at the soles. If the soles on them are wearing evenly, probably don't have this going on. If the soles are wearing unevenly, might want to get your SI joints checked. And stop blaming your IT band. It's not its fault. So if this sounds familiar or commonplace or something like that, if it's something you want to get checked out, come on in here. We'll do an exam. We'll do all this kind of stuff. And there's a really good chance you're going to leave here feeling better than you did when you walked in. Now, all you got to do is walk through that door, give our office a call. Because right here at Chiropractic, we're ready to help you when you're ready to be your best. Naturally.